Welcome to Empowering Plans, a show dedicated to identifying waste and undue expense in the health benefits industry, discovering ways to maximize benefits while minimizing costs, and empowering employers, administrators, and consultants to emphasize, once again, the benefit in benefit plan. Today's episode is brought to you by the FIA Group, empowering plans since 1999. Now here are your hosts, the FIA Group's own CEO, Adam Russo, and Senior Vice President and General Counsel, Ron Peck.
Hello, this is Senior Vice President and General Counsel of the FIA Group, Ron Peck, here with a special edition of the Empowering Plans podcast. With me is Brady Bizzarro. Brady, hello.
Hello, Brady.
I didn't say hello, Brady, just said hello. You see, I got you there. I'm trying to wean you off of that. I should have copyrighted that, say hello, Ron deal. What was that, like years ago, right? I should have copyrighted, but unfortunately, Brady, you're the reason why the intellectual property rights and laws in this country are so important and why they need to be protected.
Well, thanks. I like to hear that.
Yes, you're proof positive that the law is there for a reason. Speaking of laws and things that are important, we're not currently joined by our brave and fearless CEO, Adam Russo. He is on the road representing the company, as he often does, and we thank him for being such a road warrior, even though, frankly, he could be at home in the hot tub or out on the links playing golf. But he's out there representing the company, so thank you very much, Adam. Brady and I are here to discuss something that I think is very relevant and timely. We're going to strive to get this posted, hopefully before it's the expiration date has already come and gone. But for those of you who have been living under a rock, it's time for elections. Hooray! And one of the things that if you don't know Brady, I'm going to introduce him and explain who he is in basically one sentence, and that is Brady is the bridge between health, law, and what we do at the FIA Group and politics. Okay, he's the lens that we look through when we want to understand how politics are going to affect what we do here. And he's on overload right now because it is political time in the country, at the state level, at the federal level, and he has been for the last week just pounding on the door saying, we need to do something. We need to talk about what's going on out there, the politics, how it's affecting what we do here, how it affects our clients, and the healthcare and health benefits in the country today. So that's what we're going to do. And, I know, Brady, you have a lot of specific examples that you want to talk about and some more general things. But before we get going, it's amazing. I was driving in this morning, and there's a huge billboard right off of 93 when you get off exit 6 in Braintree, where we're located, huge billboard. And it says, question 1, not right for Massachusetts, not right for nurses, not right for patients. Say no to question 1. And we're not going to opine on the pros and cons of question 1 here, but for those of you who don't know, question 1 is a ballot question in Massachusetts, which is basically suggesting that they impose a mandatory 4-to-1 nurse-to-patient ratio at hospitals. I'm sure there is all sorts of fine print and things like that, but ultimately that's what it's about. And you basically have nurses on both sides of the argument saying it's good for patients, it's bad for patients. And I think that this question and a lot of the things I'm sure Brady's going to talk about today, I think are symptomatic of what I call the healthcare grows on trees effect, which is that everybody's out there saying, we should do this for healthcare. We should do that for healthcare. Cover this, cover that. Give us more of this. Give us more of that. And they don't talk about the cost. So the opponents of question 1, they try to talk about cost, but they don't say, hey, it's going to cost more. They say, oh, it's going to limit our ability to hire more nurses, or limit our ability to hire doctors, or limit our ability to offer other services, or, it's going to increase your copays and deductibles. So they don't just strike at the cost issue directly. They kind of come around the back door and talk to the patients, the people who are voting, and say, this is how it's going to affect your bottom line in a bad way. But it's almost as if it's dirty to just say, hey, look, you want all that health care? It's going to cost something. And like I said, health care doesn't grow on trees. Nobody just wants to come out and say that, which I think is hysterical. But yeah. Brady, I know there's a lot of things that are stuck in your craw that you want to talk about.
Yeah, so I'm glad you brought up question 1, Ron. It represents just healthcare's on the ballot, right? In 5 days from today, it's on the ballot across the country. There's many state ballot initiatives, including Massachusetts, that involve healthcare in some way or another. Despite all you may have seen on the news, I'm sure you're seeing all these political ads. You're just tired of it. You want to throw your TV out the window at this point because literally every commercial is some ad where so-and-so is going to steal your healthcare or not, right? And you see this caravan marching towards you. But look, despite all that, healthcare is still one of the number one issues that voters have identified in the midterm elections. It often is, but this time is really special. I think it's really important because of what we've seen and been talking about for the last almost 2 years at this point in government, right? We have administration who is determined to repeal or was determined to repeal and replace the Affordable Care Act. So the outcome of these midterms is really going to have a serious impact on the largest healthcare law in the country. And what I did before this podcast is look at the absolute latest projections from 558, which is a famous political website which does all kind of forecasting of how things will turn out, because I anticipate that I would be asked what I think is going to happen. And I hate to go with chalk here for all you sports fans, but I'll just say that I think there's a pretty good chance that the House of Representatives is going to turn blue. It's going to flip back to Democratic control, and that the Senate will stay in Republican control. And the result of that, I think, will be, unfortunately, divided government. But I think it'll be good for the ACA because if the Republicans had controlled both chambers, you would absolutely see another serious effort to repeal all of the ACA sort of root and branch. And I don't think that's going to happen. I think what you're going to see instead is sort of more chipping away at the executive and regulatory level. But the buildup to these elections has been really interesting because it's really come down to two big issues. And one of them I just wrote an article about. But the first of those is the debate over protections for people with pre-existing conditions. Republicans all over the country have been twisting themselves in knots, trying to say, of course we support those protections. Why wouldn't we? That's the most popular part of the ACA, which it is. But many of those same Republicans have found themselves supporting a lawsuit which is challenging the ACA. They found themselves, they did support the old versions of the repeal and replace law, which would have removed many protections. And they're supporting things like expanding the use of short-term health plans and association health plans, many of which don't have to follow the same ACA rules. So it's been interesting to see Republicans have to sort of, get out of the mess they've created for themselves in trying to convince voters that they're not, and some of them are actually not against removing those protections, but that's a huge issue for voters. Anyone who has a sick relative, and many Americans do, knows how important these protections are, and it's one of the most important and popular pieces of the ACA.
You know what's interesting, Brady, is when I look back, and it's great that you bring up the fact that, and when you say it, I suddenly realize just how simple it is, but it's something I didn't even think about, is the fact that basically when you have this deadlocked Congress, it's a positive for the status quo, whatever that status quo is, because if they can't move one way or the other, well, then you just fall back to where you are. And what's interesting is I feel when I look back at that type of situation where there's this conflict, yes and no, and it's 50-50, and then you're just stuck where you are, it almost always feels like it's a question that comes down to, do we spend more on this and increase taxes, or spend less and either decrease or keep taxes where it is? Politically, if you think about all the great, elections in the past, right? It's like, read my lips, no more taxes, no new taxes, right? So that kind of thing, right? Where it's basically, you've got one politician who says, we need to do more. And the other politician says, yeah, but that's going to cost something. And that means increased taxes. And I want to increase taxes. And so from the voter's perspective, in a lot of issues, it comes down to, do I want more? And if so, am I willing to pay more in the form of taxes to get it? Whether you're talking military spending, schools, infrastructure, doesn't matter. What I think is so fascinating about healthcare and all of the issues that you're talking about that are on these ballots, that these politicians are caught up in, is that it's not that simple, right? It's not that simple. You can't have, for instance, the Democratic candidate in Oklahoma saying, hey, I think we need to continue to not only protect people and get coverage for people with pre-existing conditions, but I think we should, increase the age that you could be on your parents' plan to age 36 instead of 26, right? So expand the coverage, expand the protections, and people say, yeah, that sounds great. And then the Republican in that election comes out and says, yeah, but that's going to increase taxes by 10%. Can you afford that? And people say, no more taxes. And you vote based on that. Do I want it? And am I willing to pay for it? Or do I not want increased taxes? The problem with healthcare spending and I don't know if I want to say problem, but I guess one of the sort of the convoluted issues with healthcare spending and why it becomes such a political quagmire for these candidates is that it's not necessarily funded, at least in a great majority in people's minds, through taxes. People assume, right or wrong, that it's paid for. Someone else is footing the bill. So why wouldn't I want it? Right? You go to the restaurant, you order the cheeseburger. They say, would you like fries? You say, how much are the fries? They say, it comes with the burger for free. You're not going to say no, even if you throw them all out, right? Even if you eat one and you say, these are not very good, but heck, I didn't pay for it. Oh, yeah? They inflate the price of the burger to cover the fries, man. Use your brain. But the problem is, most people don't receive that. They don't understand that. And so as a result, I think that we, as members of the health benefits industry, we see candidates coming out and saying, hey, here's a really attractive thing. Don't you want this service? Don't you want this protection? And people say, well, of course. And then you have the opposition saying, well, we don't think we want that. And they say, well, why? It's going to cost you something. No, it's not. It's going to cost the corporation something. It's the big bad insurance company, and that's the one who has to suffer. Let them lose some profit and pay for my protection. So I don't think people necessarily see how the decisions they make in these elections now trickle down to them financially, and those who oppose these expanded protections, who are being lambasted because of it, I don't think they do a very good job of translating to the common Joe and Jane how these increased protections are ultimately going to trickle down to their bottom line and to their pocket.
Yeah, I think that's right. I think in part of or a lot of the reason I think for that is if you look at any political ad where they're discussing healthcare, it's, one party is throwing granny over the cliff, right? Or one party is saying, so-and-so is trying to take away your health care. And I think I've even seen some where they are using like sick children, and it's just awful to look at. And you just get the sense, if you're a voter out there who, like all of us have busy lives and families to care for, they don't have the time that I have to watch thousands of hours of political TV every night. But, they don't get too much into the weeds. They just see these ads over and over again. And I think, for some people, they say, hey, yeah, why? They don't know who's paying for it, as you said. Sure. They assume that someone else is footing the bill here. And in fact, there is a wing of the Democratic Party which would have someone else pay. It's called single payer, but that's also in some cases, potentially on the ballot, in the sense that some of these close House races are representing progressive members of the Democratic Party who are running on that platform, and that's in the background of all this, right? So you have the adults in the room, I would argue, who are arguing over real healthcare issues, and you have this sort of single payer thing in the background. I think no matter what happens, though, in the end, I think it's important to focus on, I want to bring up one other issue of an area where there's at least some bipartisanship, and that is on drug prices. And we did a webinar recently on this. I unfortunately was not here for that. We also did a podcast about it because it's such an important topic, and we had so much feedback from our clients, and they wanted more information about this. They want us to talk more about why these drugs are so expensive and what kind of solutions we could have. But it really is one area where Democrats and Republicans agree prices are too high, and you have an administration which, to its credit, even given so by Democrats, has taken actions which have had some impact on drug prices, forcing transparency, getting rid of the pharmacist gag rule, which was a rule that basically prevented pharmacists from disclosing lower, cheaper alternative drug prices to customers. They're fighting to get manufacturers to be required to post their prices on television ads. The president just recently signed 2 bills into law. One of them affects Medicare primarily, but Medicare, the single largest purchaser of drugs in the country, will now be, if this rule goes through, able to negotiate drug prices. That's a huge deal. It could provide some kind of benchmark pricing, by the way, for private insurance, for employer-sponsored plans to be using when they're trying to figure out what's the fair price for them to be paying for drugs. But it's sort of interesting to see this one area here where you have the president sort of praising Democrats and saying they care about high drug prices too. It's just one sort of an island though, because it's really surrounded by just a sea of disagreement among these other healthcare issues. The opioid crisis is another thing that's really on the ballot this year, where the states are pushing for more funding. People are saying that the administration hasn't done enough to deal with that crisis. Just by having a task force formed in our own state, we have a huge issue with, like many states, but ours in particular has a particular problem with overdoses, and the governor here has taken some actions to fix that. Women's rights are related to healthcare; those are on the issues on the ballot with respect to abortion and such. So it's really, I think for our industry though, at the end of the day, I think we'll know, on Wednesday, right, who has control of what. But what happens to the Affordable Care Act is really going to be the driving factor in how our clients sort of react to what happens, right? Because it determines what they have to cover, who they have to cover, and how much money it's going to cost them in their bottom line in the future.
Yeah, it's interesting because I think if you look at, I call it healthcare reform, but I mean, it's such a broad word. Does it mean the actual provision of healthcare, treating somebody's illness or injury? Does it mean the payment for that treatment? What does it mean? But when you talk about the prescription drugs, and I'm glad you bring it up as sort of the final issue, final topic to discuss, that's an example where they're basically saying we want people to either get more or continue to get what they're getting, but do it at less cost. And instead of trying to find someone else to pay, they're saying, are there inefficiencies? Are there loopholes? Are there problems in the process itself that we could clean up, which will reduce the amount that's being spent without actually impacting the quality of the care? And I think if you take that mentality and we applied it to healthcare in general, I think things would be a lot better off. I think one of the major issues that we're having right now is somebody will say, well, we need more, find someone to pay for it. Instead of saying, we need more, why is it so expensive right now? What can we do to eliminate the inefficiencies? I don't want to use the word corruptions, right? Because everyone's like, oh, there's someone greedy. Listen, I give people the benefit of the doubt, right? I'm just assuming that there is either ignorance or mistakes or things just haven't been addressed from an efficient and effective standpoint. You can identify waste and eliminate it and provide more for the same cost or provide the same care for less cost without actually negatively impacting anyone but a few bad actors. And that takes a lot of work, and that's why I don't think that attitude is very popular. It's just much easier to say, let's give people more and find someone else to pay for it, instead of saying, how can we give people more without costing more by identifying the inefficiencies and the issues in the system and addressing those. And with the drug industry, I think, and the prescription drugs that you talk about, that's one of the few places I think that they're actually attempting to do that, whether you agree with their approach or not. And that's why I think you actually see more bipartisan support there than elsewhere.
Yeah, I think so. What you're saying essentially is they're asking the right question finally, which we ask the right question, I hope, and I think every day at the FIA Group. But I think with drug prices, though, it's come to a tipping point, right? It's taken this long. It's become the single biggest concern for most employer-sponsored plans. It's eating up. It's really threatening the viability of their plans. It's costing billions of dollars. The projections are crazy. So finally, we're asking the right question at the government level, right? So hopefully, in these other areas of healthcare that are driving up costs like inpatient hospital stays, I think as these once these issues become a crisis, unfortunately, that's really when the government sort of picks it up and starts taking action. But I do see encouraging signs. And I think, as I described in the article I just wrote, employer plans, as we know, have already taken actions on their own to try and address the cost. And they're probably going to do so, up until and as long as the government's not fixing the problem. But I do think the spotlight is focused now on PBMs and manufacturers. And I think the ones that are really taking steps to try to fix the problem are going to do okay in the end. And those that are sort of bad actors that are, whether it's, Pharma Bro or EpiPen guys, I think those people, their days are limited in number. I think that's good, frankly, for self-funded plans especially because, it's our money at stake. And I hope for these other issues after the election, I hope the right questions get asked. And I hope that we can keep pushing both our partners, clients, and, frankly, lawmakers to ask the right questions as well.
Great. Good point, Brady. So on behalf of myself, Ron Peck, Brady Bizzaro, and our CEO, Adam, travel safe. Again, thank you for what you're doing on the road for us and our clients. This is Empowering Plans. Thank you for joining us, and we'll talk to you again soon. Take care.